Hi, everybody. Dr. Laura Robin here, and here with Coach Cristen, and we are of Total Health Reset, and we are just really excited to be here because we want to talk about inflammation. Inflammation is just like such a huge thing, and it's so important. This word needs to be in everybody's vocabulary because it's a reason for just about all of the different things that can go wrong in our bodies. I guess I'm simplifying that quite a bit, but what I want to say is I just want to say that the more we can understand about inflammation, the more we have control, right, over our own bodies. And the whole idea, the paradigm has to start changing in healthcare. Everybody needs to be empowered to be able to know what is going on in our own bodies and to be able to have as much control as possible over the future of our health, right? Kristen and I got together several months ago, and we are really excited to be putting out a series talking about lots of different topics that can help empower people to take control of their own health. And number one, number two, and number three, right? Inflammation, inflammation, inflammation. I guess the first thing we should talk about is maybe what is inflammation, right?
Absolutely. I think so many people, if you even say, are you inflamed or do you have inflammation? Their immediate response is to say no.
Right. I
And
don't have it. You had somebody yesterday, right? Who said, I don't have any inflammation, but she's facing two knee replacements, right? And it really hurts for her to walk, and she's about many pounds overweight, and she's tired a lot. And she says, I don't have any inflammation. So,
yeah, I think that is a big thing that I hear a lot of times when I'm talking to my clients is I'm not inflamed or I don't have inflammation, or they'll ask me, what is inflammation? So maybe you could define what inflammation is, and we could talk a little bit about how that actually shows up in the body so that our audience can start recognizing, or maybe even just asking themselves, oh, is my weight gain, all of a sudden weight gain, is that associated with inflammation or the joint pain that I'm starting to experience? So maybe you could define it and then we could talk about how it shows up so that people can start tuning into the signs of their own body.
that's a really good idea. Okay, so we have immune systems. If we didn't have an immune system, we would probably not be able to survive because our immune system helps us to be in a world that is full of germs and toxins and all kinds of things. So our immune system is there to recognize things that might not belong there, or things that might want to cause us difficulty, like viruses and bacteria and mold, and or even toxins, of which there are more than 80,000 new ones introduced since World War II. We're living in a toxic soup. So our immune systems are here to help us with that and help us to negotiate all of these things. So base and there are various numerous different kinds of cells that are part of our immune system, and those cells make different substances. They make antibodies, they make all kinds of things. Basically what happens is if the immune system detects something that is not good for us, or it doesn't think that it's good for us, or it doesn't recognize it, then it actually goes into battle mode, right? It goes into this mode of okay, we're going to sequester this, or we're going to get rid of this, we're going to help the body to get this out because it probably is not good for our person. And that essentially is what inflammation is. Inflammation is that whole process of the immune system getting pissed off. And it gets pissed off in lots of different ways. But generally, what happens is there more fluid goes to the area, more cells push out certain chemicals that cause certain things to happen around that intruder. We might think about a bee sting
Scratch.
or a scratch or something like that. Okay, that happens on our skin and we watch what happens. So first off, we have the initial injury and it may show up as a little bit of nothing. And then, but what's going on microscopically is that the immune system says, hey, there's something going on there. This does not look right. And so we're going to go into battle mode. So what may happen is around that scratch or that sting or whatever, we're going to get some swelling, which is all the fluids coming in. We're going to get some redness, which are the chemicals being released, and it's going to start to itch. It's going to start to feel angry and feel warm and these kinds of things. And all of these reactions by our body against this intruder, i.e., the scratch that might be introducing bacteria or the bee sting that might be introducing some toxins. It's this elaborate, gorgeous, life-saving mechanism that our bodies can do to help us get rid of the intruders. But that is what inflammation is. So inflammation can be a really good thing. It can be a lifesaver. But on the other hand, it can also be something that's happening over and over again in our bodies on a more general scale that doesn't need to be happening. Things like, for example, what would be a common thing maybe that would cause inflammation in our bodies? One of the most common things that can cause inflammation is leaky gut, for example. So our gut, and you may have heard more and more, I know you have, Cristen, but our audience may have heard more and more about like why gut health is so important to the health of the rest of the body. But basically our gut and our gut wall, the lining of our gut is crucial to keeping the bad stuff out and not letting the bad stuff in. So we can picture our gut as being one big tube where the lining of this tube is just very solid. And the whole purpose of this tube is so that food and liquids and other substances can go through. And the lining of this tube is brilliant in that the cells and the components of the cells that are lining this tube are there to be able to identify, oh, where are the nutrients? Let's pull the nutrients into the cells of the body. And where are the bad things, the toxins or the parts of that food that can't be used by the body? We're going to keep that in the tube. So that's what the intestinal wall and the individual cells of the intestinal wall are doing. But what happens is there are lots of foods out there that contain things like dyes and pesticides, herbicides, preservatives, additives, all these different things that our bodies don't like, can't use, and that can actually be dangerous for us. So the cells of the intestine then do things to try and keep them out or fight against them. But sometimes what can happen is that there becomes a whole little battle going on in there, and it can make the wall of the intestine not as solid as it used to be. And we call that leaky gut. There can be damage to the wall, to that really good solid wall. And when there's damage to that wall, things can leak through. So all of those, the good stuff can leak through and lots of bad stuff can leak through too. The bad stuff like the preservatives and the additives and the dyes and the colors and the stuff that our bodies can't use. And then that stuff leaks into the fluids in and around our intestines, right? And that's in our immune system. We've got a lot of components of our immune system in and around the intestines there. And what happens is that same inflammation that can happen with the scratch or the bite ends up happening in those tissues in and around our intestines, but there's no barrier. And those fluids, all of those fluids, the histamines, all the fluids and the cells that are trying to deal with everything, they disperse all over the body. And that's what generalized inflammation is. Does that make sense?
Yeah, so you gave us a great overview there of how does our immune system really is our first gate to the environment that we live in. And based on the environment and what our bodies are being exposed to may or may not turn on our immune system. And then when our immune system becomes overburdened because we have too much coming at it, it can cause inflammation. And one of the ways it does that is through leaky gut. So you covered a lot of material there, and I hope that everybody can take time to pause and take some notes and really try to understand our immune system is here to guard us and protect us from the environment that we're living in. And it can handle the occasional insult, right? But
Mhm.
unfortunately, it's like a bucket, and eventually that bucket becomes overfilled and overflows, and then that's when we can start to see chronic inflammation. So just like the bee sting or the scrape or the cut that you see, that what you would call acute inflammation, right? So all of our defense mechanisms and our immune system are coming to heal the body in that localized spot. But if we have something like leaky gut, as you nicely explained to us, that becomes chronic inflammation that can show up in different ways. So maybe we could talk a little bit about those ways that you can just start to identify if you have this chronic inflammation, this chronic immune system that is trying to speak to us through different physical things happening in our body. So maybe having a super puffy face or getting a skin irritation like rosacea or eczema. I know acne can also be inflammation, but it can also be hormone based. That might be another skin thing that we want to talk about or to look at as a potential for a sign of inflammation. But what might be some other signs our body is telling us that the immune system is inflamed and is trying to express that so we can pay attention and really ask, what is it the root cause of my immune system being overinflamed?
Yeah. So it's a really good question. What does inflammation look like in the body, right? And
Yeah.
so the interesting thing is that it looks different for everybody. And that's one of the things that makes inflammation so confusing. Um, we can, because the truth is that everybody is different, right? Every
Yes.
body is different. So how inflammation affects me might be different than how inflammation affects you. So there's generalized inflammation, and then there can also be inflammation that can affect specific aspects of the body. So generalized inflammation could look so many things. It can look like fatigue. It can look like
Mm.
brain fog. It can look like not being able to sleep. It can look like, as you said, general puffiness. It can look like weight gain. It can look like, let's see, what are some other, can you think of other things that
So,
generalized inflammation can cause?
yes, I'm thinking joint pain or stiffness, right?
General, like I feel stiff.
Yes.
Yeah. And yeah.
How about digestive issues? So I know we talked a little bit about leaky gut, but also understanding some of the symptoms that our stomach may be telling us that the food or the beverages or what we're consuming is not sitting well with us. It is causing not only leaky gut, but inflammation in the gut, right?
hmm
So things that our stomach and are maybe telling us are gas and bloating,
hmm
right? Do we experience that bloating feeling every time we eat something, which could be a sign that there's something bigger and more inflammation in the gut versus that occasional I ate too much at Thanksgiving or something like that, or irritable bowel, right? That could
hmm
also be a sign of inflammation in the gut. We talked a little bit about skin issues, so eczema, psoriasis, rashes that might show up. I know for myself, I have an issue with the penicillin family, and so I will get a rash. Just understanding, I think the how your body responds to foods and medications and the environment that you're taking in, and then realizing, oh, a rash means that maybe what I'm taking in or being exposed to isn't healthy for my individual immune system. So rashes can be a great sign of
Mhm.
some bigger type of inflammation there. We also talked about a little bit about weight gain or weight loss. Would you say weight gain is typical of more chronic inflammation than weight loss, and when you might see one or the other?
Yeah, I think weight gain is very common from inflammation. It's very interesting because as part of my practice over the past many years, I have put most people on a food elimination protocol and a gut repair. And the whole purpose of that is to remove any foods that could potentially be causing inflammation and also to repair that lining of the gut so that the immune cells that are lining the gut don't get pissed off and cause inflammation. And typically what I see is when people remove foods that are potentially causing inflammation, they lose weight quickly, and they
Mm,
might lose 10 pounds in a week or 2 weeks or something along those lines, and they feel better, and they look different. Their face looks different. Their whole body looks different because the body is not fighting so hard anymore, and those fluids just go away. They get peed out, pooped out, sweated out, all of that kind of thing. And it's amazing because people say, "Wow, where did my belly bloat go? My hands aren't swollen anymore," this kind of thing. So removing the causes of inflammation and just letting the body just calm itself down can be pretty amazing even in the first couple of weeks. But I wanted to say something to we talked about generalized inflammation and what things can look like, and it can look like whole body rashes or can look like weight gain or bloating or fatigue or brain fog, these kinds of things. But also because our bodies are different, each of us has had experiences. We've each had injuries. We may have a little bit of arthritis formation in our wrist or in our knee or something along those lines. We may have other parts of our bodies that are super sensitive. And another thing that can happen with inflammation is inflammation can target that what we call the kind of Achilles heel parts of our bodies. So let's say a perfect example right here. I'm an osteopathic physician, and in my practice I did a lot of hands-on manipulation and just using a lot of pressure with my hands, and I over time developed a bit of arthritis in my thumb joint. And so I that has become for me my Achilles heel, or my one of my barometers regarding whether I'm eating something that's inflaming me. The first thing that will tell me that I have eaten something that's inflamed me is my thumb. For example,
mm.
the nightshade family, a very common family of plants that can cause inflammation in some people. And for some people, it's all of the nightshades. For other people, it might be one or two of these plants. So generally, nightshade family, tomatoes, potatoes, eggplant, pepper. For a lot of people, for example, who have arthritis, eating of the nightshade families can increase inflammation in their bodies. That actually targets those Achilles heel type areas that might be more prone to pain with inflammation. So that's my barometer. I know, I know when I've eaten something that And the empowerment, the whole purpose of our little talks here is to empower people to get to know their bodies better and to know that we all have an enormous amount of control over how our bodies work. Knowing these things, for me, it was going through a food elimination process and protocol, and then adding things back really slowly, adding things back one at a time, and actually testing things to see, okay, is this just a fine food for me, no problem at all, or does this cause me to have pain in my thumb, pain in my knee, an irritable bowel? Does this particular food make me run to the bathroom? Does this particular food, if I eat it within 2 hours of going to bed, does it keep me awake? Does it make it difficult for me to fall asleep? If I eat, another really common thing that can cause inflammation is sugar, right? So there are people who, if they eat sugar before they go to bed, maybe they can't get to sleep because sugar does a whole bunch of things, but it can also cause inflammation. But can sugar cause somebody to have difficulty getting to sleep, or might it be something that then might wake them up early because of the what their body is doing to overnight to process that bolus of sugar? Inflammation can look like a lot of different things, but in my practice, one of the really cool things that would happen when people would get rid of their inflammation is I had a number of people who no longer needed to have their knee replaced or their hip replaced, because once they got rid of the inflammation, the pain went away. For example, so this is a great example. So somebody who is facing knee replacement or facing hip replacement or shoulder replacement, what's happening in those joints is that wear and tear, or maybe injuries over years. What happens is that over time, there that joint starts to get destroyed um by anatomical changes that are happening in there, bone growth in the form of arthritis, that kind of thing, or deterioration of the joint space or the cartilage, that kind of thing. And those are very real, very on the ground, very measurable things. But the reality is that what causes pain is not only those anatomical changes, but it's also a measure of inflammation that's going on in that joint. So it's the anatomical changes that have happened over time, plus inflammation that tends to aggregate in that area because that area is already injured. And in my patients, when they would go through a food elimination and a gut repair and getting rid of toxins that don't belong in our bodies anymore, what would happen is that their levels of inflammation would go from here way down, and that there would be measurable changes in levels of pain in those joints. So I had a number of patients who just said, wow, Dr. Laura, I came in knowing that I was about to get a knee replacement and wanting to shore up my body so my body would be ready for the anesthesia and for the surgery and for the recovery and all of this stuff. But the reality was that after a month of cleaning up my body, the inflammation's gone down so much that I don't even have any pain in my knee anymore. I don't need that knee replacement anymore. And so inflammation can look like a lot of different things. It can look general, like brain fog, fatigue, listlessness, sleeplessness, anxiety, depression, ADD, where the more we learn about inflammation, the more we see that it plays a role in all kinds of things that go on in our bodies, or it can play a role just in one specific place.
Yeah, wonderful. Thank you so much for all of that wonderful information. I'm wondering, I know we've spoken a lot, but I know there's also some lab testing that we can do to check for inflammation. If what we've shared today isn't enough for somebody to question whether or not their symptoms that they're experiencing could be linked to inflammation, what would be a test that they might be able to ask their PCP for or order for themselves? I know there's the high reactive C proteins or CRSP or
CRP.
yeah,
Mhm.
can you please tell us a little bit about that maybe? And if somebody just wanted to dig a little bit deeper and confirm their suspicions that they have inflammation, what is this testing that they could do?
Yeah, I'm really glad you're asking this question because my mantra is that everyone has the everybody has the ability to take good control over their health. And one of those ways is to be able to measure what's going on. And unfortunately, the current conventional medical model that most of us use in America is there are wonderful things about it, and it's excellent for crisis care and for from keeping us from dying when we're in the intensive care unit and those emergency surgeries and all of that kind of thing. Conventional medicine is right on about a lot of things. One of the places, however, that the whole model has fallen short is that there are a lot of really good tests out there that are really not expensive, but because of how things work, they're almost unavailable to most people, and they're very often not recommended, they're not paid for by insurance companies, and therefore they're very often not talked about by our medical professionals. And one of those things is a CRP, or a high sensitivity HS-CRP, high sensitivity CRP. And CRP stands for C-reactive protein, and it's a fairly general way of being able to measure levels of inflammation. It's not perfect, but if we were looking for one cheap and easy test that's going to tell us, are we generally really inflamed? It would be the CRP. And so if you do have a provider who you can ask for to do a CRP, a high sensitivity CRP, HSCRP on you, it's a super cheap test. And if you can't, then there are places where you can find a CRP. For example, I have just released a new way on my website for people to be able to test themselves for some of these common, inexpensive lab values that can tell us an enormous amount about our health. And CRP is one of those things. So anyway, so you can also go to rosahealth.com. It'll show you how you can test yourself for inflammation and other biomarkers that are really important in empowering you to be able to take control over the future of your health.
Yeah, so maybe we could include that link down in the description for this video. Yep, right down there. We're going to be sure to include that for you to make that easy to click on and take a look at the variety of tests that you can order straight through Laura's website, rosahealth.com.
Yeah, at this moment in time, the CRP is part of a what we call the cardiometabolic panel. And it's a really wonderful panel that looks at a bunch of different biomarkers that are otherwise either unavailable to folks who go through their regular conventional medical system, or they are crazy expensive because uh, if they go through the insurance and your usual lab needs to bill the insurance, they will often bill the insurance 10 or 15 times the actual cash cost of the test. So what I've done on the rosahealth.com website is I have figured out how to offer tests at cash prices that are so much less expensive, so that anybody who wants to know what's really going on with their health from a preventive, from a root cause perspective, can actually now access that without having to go through a doctor to be able to get those tests.
Yeah, so I think that is a great topic for our next live talk here. Maybe we can talk about being the owners of your biology and the owners of your health data, right?
Mm.
That you can own what is happening, you can own the data, and then how do we partner with our medical providers when we understand where some of our biomarkers might be off and we want some help. So maybe that would be a great topic for another conversation, that we could just help to educate people on what type of testing is available, why they might consider doing it, and then how they can order that directly for themselves.
I think that's a great idea, and maybe we should do that next. That would be really
Wonderful.
wonderful.
Yeah, so I think that we really covered a lot today. We talked about what inflammation is. So, inflammation, just again, is our immune system responding to our environment. So, our environment could be our physical environment or the stuff that we're taking in. That is a different type of an environment, or the environment on our skin, thinking a broad perspective of all the ways that our body is experiencing and just with nature and everything around us. And then we
Mhm.
have acute inflammation. So that's something that's localized and has an end date, right? It's like you cut yourself, we know that cut's going to heal. Or you get a bruise and we know that bruise is going to heal. That would be acute inflammation. And then we also talked a lot about what chronic inflammation is and the various ways that can show up in the body. And we hope that's enough for people to just take maybe a minute, right? If we all have a minute, we can just do a body scan, ask
Mhm.
ourselves where we might be feeling chronic pain. Like for you, you said it was in your thumb. For other people, could be something different, but we gave you everybody a great list of things that they could ask if they're experiencing any of those things. And then also that test if somebody was interested to actually see and measure their inflammation in their body. So I think we definitely gave everybody a lot of food for thought here. And speaking of for thought, if anybody is interested in learning more about their body and how inflammation can be impacting them, we would love to invite you to do a strategy session with us to learn a little bit more
I was
about our
just about to
program.
say that.
Yeah. So we do have the Total Health Reset, where we do walk you through an 8-week program that Laura did in her practice. If you think you're experiencing any of these things and you're just like ready to take action, we invite you to sign up and do a strategy session with us
And
to make
hopefully the
sure.
link is gonna be below for this
Yes.
strategy session as well.
Yeah. Or if
Yeah.
you're interested to know more, Laura has a wonderful webinar that is free that you could
Mhm.
learn a little bit more about the program and also learn a little bit more about your health and the questions to ask yourself. So we do invite you to continue to tune in to our YouTube channel here, check out our free webinar, set up a strategy session, but just stay involved and invested in your own health because you are the only one that can make a difference through the actions that you take daily.
Beautifully said.
Thank you.
Beautifully said. Thank you, Kristen. Yeah, and again, our whole reason to be here is to help empower you to take control of the future of your own health. So, thanks for joining us today.
Thank you.
Okay. Bye-bye now.